Patients with chronic low back pain have reduced accuracy of movement. And that's really important for balance, because with balance, we're trying to maintain your center of mass or your center of gravity over your base of support. So if you try standing up with your feet together, you'll see you can't actually shift your center of mass very far before you reach that tipping point where you fall over. So when people have low back pain and they can't control mobility and stability as well, what you see is they overshoot or undershoot that sweet spot. The result is a little bit of a sway. That sway may not look like much, but it's dangerous because it takes them closer to that tipping point. Furthermore, they have reduced endurance. So when they do find a good posture or a good position where they're safe, they can't hold it for very long before they start overshooting and undershooting again. And lastly, people with chronic low back pain seem to have used proprioception less for balance. So your brain uses your eyes, your ears, and the feedback from your body to control movement, balance, and posture. So your visual system, the vestibular system, and proprioception, you use that to create a sensory map of you and your environment. And once you know who you are and where you are, you can decide how to interact. Do you move towards the apple, away from the snake? So when people have chronic low back pain, they generally use proprioception less and they use the visual system more, which is something we also see in dizziness patients. But they use the vestibular system less and the visual system more. And that's okay, perhaps, as a short-term strategy, as long as you're always looking at the floor and seeing what you're stepping on, around, or through. The problem comes that the day you're walking down the stairs and you're holding a box and you can't see your feet. Or perhaps the pet dog runs underneath your feet. Or you're just walking along having a chat with a friend, you're looking at them and you don't see this slight patch of mud on the floor. The problem is the visual world is also full of loads of optic illusions, tricks of light, colour contrast, depth perception. So what should happen is you see something move or you notice something and your brain says, did it move or did I move? And to work that out, it then goes to your vestibular system and to your proprioceptive system to say, hey, body, what did we do? I saw something moving, did it move or did I move? And you will have experienced this yourself. If you've ever sat on a parked train, your train isn't moving, you're next to the window, you're looking out the window. And next to you is another train, and it's not moving either. And suddenly the train next to you pulls away, and you'll have for a brief moment that sensation of, we've left. Before you tune in and say, oh no, trick, optic illusion, we haven't moved yet. That happens all the time. Your brain is subconsciously dealing with that situation all the time. So with people with chronic low back pain, they're going to start having trouble controlling balance because they're basing movement not on reality. Sounds a bit dramatic, but it's true.